Wrong question was asked in neetpg 2024. Can you believe it? Let me show you this question. The answer for this question is not any of these above options. It is entirely different. Let me clear your concepts regarding this so that you don't make same mistake in upcoming neetpg. Save this reel. Fever with purpura with joint swelling and cardiac murmur shouldn't tell you the answer is not acute rheumatic fever. Remember, in acute rheumatic fever, we don't get purpura. Purpura is not characteristic. The rash that we get is known as its erythema marginatum, and it is not purpura. Fever with purpura with joint swelling and cardiac murmur occurs in one more condition, and that is, yes, it's infective endocarditis. So if same question was given in the same exam along with infective endocarditis as an option, then definitely you would be in a query whether to mark acute rheumatic fever or infective endocarditis. So let me make it clear. Fever with purpura, joint swelling and cardiac murmur is infective endocarditis. Without purpura will be acute rheumatic fever. Now why so? Because in MCQs always infective endocarditis are given along with other factors like Janeway lesions, with ossular nodes, with Roth spots, and there will be history of high grade long term fever. But in acute rheumatic fever you will get other features such as CRP levels, ESR levels. You will get all the criteria regarding Jones modified criteria. So what about other options, that is juvenile osteopolyarthritis? Believe me, there is nothing like that. Now the new term is juvenile idiopathic arthritis. And what is seronegative arthropathy? It is renamed in pediatrics as enthesitis related arthritis. And what is rheumatoid arthritis? Do we see rheumatoid arthritis in children? Actually no, we see a different subset of rheumatoid arthritis that is known as polyarticular juvenile idiopathic arthritis. So basically in JIA there are 4 types, out of which the most common is systemic onset JIA, second is polyarticular JIA, which I told you just now, and third is enthesitis related JIA, that is enthesitis related arthritis, and the fourth category is oligoarticular JIA. There are few more according to recent classification, but we won't go into depth with that. So the classic feature of these 3 JIAs is chronic arthritis. It is lasting for more than 6 weeks, except in systemic onset JIA, even if it is lasting for more than 2 weeks, you can consider it as JIA. So this should be clear in your head. In JIA, cardiac murmurs don't occur. If cardiac murmurs are there, always think along with migratory polyarthritis, think of acute rheumatic fever. But if there is purpura, also think of infective endocarditis, and don't make this mistake in your upcoming exam. All these mistakes I have consolidated as a PDF. Link will be given to you. Just mention Jones.